First day in the new job and there's no escaping some hard truths.
What have been the main things that you've noticed?
The main things I've noticed when half the place is closed down.
Simon Stevens today was back in the hospital where he first worked in the health service, Shotley Bridge in County Durham. Now he's running the whole NHS in England.
Everybody knows that the NHS does a great job when you get sick, but I think there's also a realisation that we need to support people better to help people stay healthy.
Simon Stevens ran hospitals and health authorities in the NHS before becoming an advisor to Tony Blair. He then went to be executive vice president of a private health firm in the US. He's taken a 10% cut in the salary paid to his predecessor to take this job, but he'll still earn £189,000. He says the NHS faces the biggest challenge in its history, caring for an ageing population on a limited budget. Today we spoke to 3 people with close experience of the NHS and with views on the priorities for the new boss. Professor Chris Ham is a leading analyst on the NHS. He says the boss's first job will be to find some more money.
Even if we can squeeze more out of that budget, he'll have to go to the government at some point and say extra funding is inevitable to ensure health and social care can provide the standards of service that people expect.
Dr Bob Gill is a GP in Kent. He believes for too long, too much of the NHS budget has been going into administration.
Which represents £10 billion, which is diverted away from patient care. I think we need to stop this diversion of money and refocus this money back on delivering care.
Samantha Berman was horrified by the care her father received as he was dying in hospital. She wants to see the attitudes of frontline staff towards patients transformed.
There's no kindness and compassion anymore. It's just like they're there to do a job. They don't seem to have any compassion for feelings of patients that are very ill and dying. You know, they want to see a kind, smiling nurse looking at them, and there's just coldness.
The new boss could be forgiven for feeling the pressure. Andy Bell, 5 News.